All right, guys, this is a 28-year-old male coming in post-MVC on the highway, was wearing a seatbelt, positive airbag deployment, multiple car rollover with positive LOC, complaining of abdominal pain. Vital signs, heart rate of 98, blood pressure 138/76, respirations 22, 98% on room air, GCS of 15, reporting 7 out of 10 pain. 5 minutes out.
Thank you.
All right, I want to do a quick roll call real quick.
Danielle Scribe.
Test X-ray.
Zach, X-ray.
Tom, there's 2.
Zachary, Tom.
Taylor, resident. Sabrina, RT.
And Drew, there's 1.
Tiffany, the attending.
Sounds pretty basic. It's coming in, not too much. Did you see anything about fentanyl beforehand or anything like that?
No, they didn't mention any events right now.
And no access. We don't know who's bringing it. Some crew.
911 crew.
Is this a scene or a transfer?
Patients up.
Sounds like a scene.
Hey everyone, we're gonna have our patient moved over here and off of our stuff, and then we'll do the report. Okay, everybody ready on the count of 3?
Can we get one more person over? Oh, okay.
On the count of 3, ready? 1, 2, 3.
Next report.
This is Forrest Green. He's a 28-year-old male who was involved in a motor vehicle accident, approximately 65 miles an hour, not wearing a seatbelt.
Thank you.
Bystanders at the scene said he had a loss of consciousness, unknown period of time. He was, although now he has regained consciousness in GCS of 15. Minor abrasions on his face and chest, no extremity trauma. He's got 1 peripheral IV, 18 gauge. He's had 500 cc's of fluid since departure, 50 mics of fentanyl for pain. These distal CSMs are all intact. C-collar is precautionary. No other injuries found on exam.
What did the car look like?
Mangled. Yeah. Lucky.
Is there a reason to actually have breast on people bilaterally? He has 2 plus radial pulses bilaterally, 2 plus TP pulses bilaterally. Can we roll him? Or are we satisfied with our IV active?
He's got that
Nasal
1 peripheral over there. I'm good with that.
Okay, can we roll him? Let's go to the patient plus.
Yeah, we don't have blood pressure yet.
Thank you. His abdomen soft, non-distended, non-tender. His pelvis is stable, non-tender. Hey buddy, squeeze my hands. Pull toward you. Push away. You feel this on both sides?
Mm-hmm.
He's 5 and 5 in the upper extremity, sensory intact.
Oh, thank you.
Can we get him some warm blankets?
We got one. We just threw one on. Grab another one so it's rolling.
Hey buddy, push against my hands. Push up.
Where's blood pressure up?
Can you lift your leg? Lift his leg. You feel this on both sides?
36.3.
He is 5 and 5 in the lower extremity, sensory intact.
On my count, 1, 2, 3, roll.
Alright. He has some abrasions across his right lower back. Does this hurt when I'm pressing?
Yes.
He has some low thoracic spine tenderness. Is it hurt down here?
No.
Okay. His back is otherwise clear. His right flank's clear. His right axle is clear. Back down.
Alright, 1, 2, 3.
And we'll baby roll this way. You guys can look at that
I'll
slide.
check that in.
1, 2, 3.
Is X-ray here?
Left foot.
Yep,
Clear.
X-ray's here.
Clear.
And 1, 2, 3.
X-ray, chest and pelvis. Hey, Blake. Are you wearing a seatbelt? Did you hit your head?
I don't know. What?
Okay, do you remember passing out at all?
No.
Okay. What medical conditions do you have?
Nothing.
Okay, have you ever had surgery before?
No.
Do you smoke?
No.
Okay, you drink a second one.
Yeah.
X-ray ready.
Okay, but any recreational drugs?
No.
Any history of bleeding disorders?
Nothing I'm aware of.
Bleeding disorders in your family?
No. X-ray's ready.
All right. Take a deep breath in and hold it. Cut it out. Thank you. Probably super fast by then.
You can go ahead and give me some 50 fentanyl.
50 mics fentanyl. Do you have that over there?
I don't have it right here in front of me.
X-ray ready again?
Did we get the labs sent?
Yeah, I'm doing those right now.
Once the x-ray's done, we can start on a fast exam.
We're good. Watch what everybody says.
Sorry, his pupils were 3 equal bilaterally and his GCS was 15.
Lab's going.
That's going.
He has some abrasions to his right cheek and right chin.
Here, you need me to grab
Can I visualize his right
Yeah, if you
TM?
would like.
Yeah.
Thank you.
His left TM is clear?
That's is negative and oscillate. And lungs.
Nice. Can we change this color out? Is CT ready for him?
We'll give him a quick call.
Does it hurt when I'm pressing it?
Yes.
50th
He has some cervical spine tenderness as well, so we'll add a CTA neck to his hands.
50 mics fentanyl giving.
In addition
50
to
mics
his
of
hand.
fentanyl.
Looks like we're all good.
I'm
I'll get the urine when we come back.
Sounds good.
And then let's go to CT from here.
Okay.
CT ready for him?
Looks
T
like
is ready.
Okay. All right, we can head on down to CT.
That's good.
Anything that you're missing?
I got it all.
You need my signature?
And your signature.
Oh, has everybody get the signatures before they go, please?
PD there. PD on the way.
Yeah.
Yeah.
Hey guys, I have a report. This is a 42-year-old male coming in dark flight. He's a logger climbing a tree to remove some branches. The harness broke and he fell about 25 feet. He landed on branches on his way down, tearing the back of his knee. Bleeding's not controlled by pressure. It sounds like some of his coworkers applied a tourniquet to the left lower extremity. Coming in with a heart rate of 98, blood pressure 138/76 with a lowest of 101/56. Respiration's at 22, 98% on room air with a GCS of 15. He is complaining of left rib pain and they're about 5 minutes out.
Thank you, George.
Can we do roll call?
Roll call.
Zachary, trauma?
Yep. And then
Tom, nurse 2.
Taylor. Fast.
resident.
Patient up.
And
Sabrina RT.
Drew, RN, we're nurse 1.
Danielle Scribe.
Hey there, folks.
Yeah.
I'm gonna get our patient moved over and disconnected, and then I can give you a full.
Thank you.
It's off of all of our stuff. Need some people on the other side so we can move them over. I've got C-spine.
Can we just go up a little bit with this section?
Up a little bit.
On the count of 3, everybody ready? Yep. 1, 2, 3. All right, I'll be back. He is a 45-year-old male who was cutting a tree about 25 feet up in the air. The harness that he was in broke and he fell, hitting branches on the way down, landing on the branches below. Denies any loss of consciousness. He's got EMS coworkers found an open bleeding wound on his left lower leg, and they applied a tourniquet because they were not able to control it with direct pressure. We met the ambulance crew at the helipad at Grace Cottage. He never went inside. En route, we were able to put in an IV. He's got an 18 gauge on that right side. He's had 100 mics of fentanyl.
Gotcha.
No loss of consciousness. His chest is stable, though he's complaining of some right-sided chest pain. Pelvis is stable. Moderate amount of bleeding from that wound in spite of the tourniquet. No other extremity trauma noted on exam. However, we did not roll him. Vital signs have been stable, heart rate of 100, blood pressure of 105 over 72, and his respiratory rate has been 16 and unlabored. No other issues while en route.
What time did this happen?
That was about 45 minutes ago.
Is there a recent deck? He has breath sounds equal bilaterally. He has 2+ radial pulses bilaterally, 2+ PP pulses bilaterally. We're waiting on some vitals, and then we will enroll him. Are we satisfied with our IV access?
He's got 118 on this side.
Is X-ray here?
Yep. X-rays here.
Is CT here?
CT's not here. They were in the middle of a stroke.
If someone could work on alerting CT.
Can do. And temperature.
2 liters nasal cannula.
Got it.
While we're waiting, he has a tourniquet to his left thigh. He has this dressing here that's wrapped that will take off momentarily. He's not having any active external signs of bleeding,
35.8 oral.
35.8.
although he still has this palpable pulse.
On the left leg.
Yep.
You get a turn.
The turn is on.
Turn is on.
Bleeding control, he still has pulse. It's perfect.
See how the blood pressure turns out.
Doc, do you want to know if there's a fentanyl while we're waiting?
Sure, let's give him 50 mics of fentanyl.
Gotcha.
He's not hypotensive, he's normal cardiac. Can we roll it? Can we get some help rolling him? We'll need 2 people on the other side. We'll roll toward the patient's left. Give yourself a hug, buddy.
You take that hit.
Have a C-spine. And on my count, 1, 2, 3.
All right, he has an ulcerative wound on his right gluteal area as well, times 2, and then 1 on the left gluteal area. His back is otherwise clear. He has no step-offs. Does any of this hurt where I'm pressing? No. He does not have any spinal tenderness palpation. His right flank and right axilla are clear back down.
And 1, 2, 3.
You just do a partial roll this side, and one of you can just glance at his flanks and axilla.
And on my count, 1, 2, 3.
Axilla clear. There is a left hip wound, and this is raised over the side.
1, 2, 3.
X-ray.
X-ray.
Can I get a chest X-ray and pelvis? His pupils are 4 and reactive. His DCS is 15. And we can go ahead and draw labs.
We'll give you 50 of fentanyl.
50 of fentanyl.
While we're waiting on the X-ray, his face is stable. He has no blood around his mouth or nose.
Scribe, 50 of fentanyl's been given, please.
Got it. 50 fentanyl.
He has some abrasions across his right chest. Go ahead.
Watch your head.
Thank you, Carolyn.
His abdomen is soft, non-distended, non-tender.
Seeing a high heart rate. Would you like a bolus or something? You want to give us some fluids?
X-ray ready,
Let's
you guys
hold
are?
for now.
We'll hold for now.
Yeah.
Thank you. We have all that on. You can go ahead.
Perfect.
Take a deep breath in and hold it.
Breathe.
Go.
We got 80 labs.
His pelvis is stable, non-tender. Yet he has some abrasions to the bilateral lower extremities anteriorly.
X-rays ready again?
Does anybody have scissors so we can cut this off?
Yes.
X-rays ready?
X-rays ready? Breathe. Wash your heads, everybody.
Thank you.
All right, we can go ahead and start with the fast exam.
Okay.
He has an open wound without bone exposure. that is hemostatic on his left medial distal thigh. I'm gonna take down this tourniquet a little bit and see if we have any active bleeding.
ZYCL is the blood code.
ZYCL, I have that.
Positive left upper quadrant for vascular.
Okay. The tourniquet's down, he does not have any active extravasation. Is that the only thing that was positive?
Yes.
Did you also do the lungs?
Only that, yes.
So the EPAS is otherwise negative, only positive in the left.
Point your lactate orders. I'm sending
Can
labs.
you squeeze my hands?
Got it, thank
Can you
you.
pull toward you? Can you push away? Can you feel this on both sides? Motor 5 in the upper extremity, see sensory intact bilaterally. You're pushing with my hand, pushing with my hand. Lift your leg here, lift your leg here. You feel this on both sides?
You said 100 pre-hospital.
Correct. Motor 5 in the bilateral lower extremity, see sensory intact.
So Tommy's at a total of 150.
150, yeah.
No, only the 1 liter boils.
He has an abrasion across his right forehead.
And I can do another ID over here.
Yeah, I'm talking stuff.
His left hand's clear. Cannot visualize his right hand's clear, cannot visualize the left hand due to his cervical collar. Can we change his collar out and get him into a softer collar? And then we'll send him to CT, we'll do a band scan, given that he's hemodynamically stable. And then I anticipate he'll go to the OR shortly after that, so could we call the OR as well? And then could we also call the blood bank just in case?
Okay.
Do you want cells, pack cells now, or do you want them just?
So just make sure those blood banks are aware. You sent the planking string, right?
Yeah, we did.
18, the left AC.
It's moving, okay?
Fine.
Yeah, around.
Does it hurt when I'm pressing? He has some low cervical spine tenderness.
We're transitioning to an Aspen.
Got it.
Okay. We can go ahead and give him a liter actually, since the fast was positive.
Thank you very
Anything
much.
that I missed?
No,
You need?
great job.
All right, great. You can take him to CT if CT is ready for him.
CT's ready? I'll get the front, I'll get the head, and I'll get the...
You guys want that liter on your way? Yeah, I'll catch up to you.
All right.